Hello, hello. This is going to be chapter 14 from Your Psilocybin Mushroom Companion, and this is a very important chapter. This one is the potential risks of psilocybin. Now, this one dives, it's a pretty long chapter and it's broken down into different sections of people that should not be taking psilocybin and possible drug interactions. And so I think I'm going to make a separate video for each one, just so it's easy to find, because I'm not some like wizard um, video editor. So I'm still getting used to doing this. So bear with me. But we'll read a little bit and then get into yeah, different reasons why certain people shouldn't be taking psilocybin. So there's a lot of talk about how psychedelics aren't for everyone, that maybe some people should avoid mind revealing substances like psilocybin due to pre existing mental or physical health conditions. It's a controversial topic in the psychedelic community, with anecdotes proving both sides of the story. At first, I thought to call this chapter Who Should Avoid Psychedelics, but changed the wording because it's not exactly true. When I asked experts about the conditions we're going to look into this chapter, most told me there could be instances of these people using psilocybin just under a much more controlled setting than your average naturalistic mushroom trip. So while this chapter is meant to give you information to make an informed decision, there are no hard or no, there are no hard and fast rules on who should or shouldn't take magic mushrooms. Yet, even Terence McKenna, one of the biggest proponents of taking psychedelics, believes they aren't for everyone. In an interview with Omni magazine in 1993, he responded to the question what people specifically should not take them, like this: people who are mentally unstable, under enormous pressure, or operating equipment that the lives of hundreds of people depend on, or the fragile ones among us, those whom wouldn't give a weekend airline ticket to Paris, those who wouldn't expect to guide you out of the Yukon. Some people have been so damaged by life that boundary dissolution is not helpful to them. These people are trying to maintain boundaries, their functionality. They should be honored and supported and not encouraged to take drugs. If because of genetic or culture or physiological factors it's not for you, then it's not for you. Who is disqualified from participating in clinical trials and why? For whom do psychedelics pose the biggest risk? To answer this question, I looked at what types of conditions disqualify people from participating in clinical trials with psilocybin. At the moment, the main conditions include hypertension and other underlying heart conditions, history of psychosis, or a psychotic spectrum disorder like schizophrenia, bipolar disorder, other persistent severe mental illness, as well as a first degree relative with any of the psychiatric conditions. Also, for the time being, pregnant people are also excluded. However, three active psychedelic researchers I spoke with all expressed a desire to work with most of these populations in the future. Therefore, it's not that people with these conditions Therefore, it's not that people with these conditions absolutely cannot take psychedelics, but the risks are greater, as we're about to explain in the next section. So there will likely be more of a need for trained guides, thorough preparation, and close post meeting monitoring. Rose Watts explains simply that these trials are essentially rushed at the moment and there's not enough time to give these populations the extra support they might require. Peter Hendricks has a different take. If something were to go wrong at these early stages, psilocybin would likely be blamed as the cause for the negative outcome. Essentially, Hendricks believes researchers are taking an abundance of caution in order to ensure psychedelic research can continue without hiccups like they encountered in the 1960s. He explains in his other research on smoking cessation, if his team were doing a large clinical trial with a new nicotine patch, they would sadly anticipate a few fatalities just due to the population. Some might be older, smoking for decades, and their deaths are a potential reality that wouldn't immediately be blamed on the nicotine patch they were testing. But with heightened political lens surrounding psilocybin trials, if anything went wrong, he believes it could potentially threaten the whole future of psychedelic research. All of that being said, if you do have one of the following conditions, please seriously weigh the potential risks and benefits of using psilocybin. And don't go into psychedelic experience without adequate preparation and support for both of the drug experience and the weeks following. So we'll go over the first one, which is hypertension and underlying heart conditions. This one's very important. The main physical condition researchers screen for in clinical trials with psychedelics is hypertension. Erica Zelfand explains that because psilocybin affects serotonin pathways, it can transiently run the risk of elevating blood pressure and altering body temperature. Hendricks elaborates, explaining that psilocybin can modestly increase blood pressure from maybe 20 points. If you have an underlying heart condition like serious arrhythmia, or you have hypertensive, it can create a condition in which the likelihood of a heart event is raised. He said that he wouldn't be surprised that a higher dose of psilocybin could cause a heart attack in someone with a heart condition. But then, so could exercise. So could a number of things, right? He adds that for people, taking psilocybin would at least require physician oversight and monitoring. There also seems to be extra risk for those who have had a past of open heart surgery. One of the only recorded deaths associated with psilocybin ingestion was of a heart transplant patient. This person received a heart transplant 10 years before her psilocybin experience, but it was apparently still too much for her body to handle, and she went into cardiac arrest 2 or 3 hours after consuming mushrooms. I guess we can go on to one more. Psychotic spectrum disorders. The main mental health condition the psychedelic community warns people about is schizophrenia or a family history of psychotic spectrum disorder. It's generally believed that taking a psychedelic when you are genetically predisposed to an experience, psychosis can speed along the time of your first psychotic break, and Henderson confirms this for me in so many words. For this same reason, he says it's especially dangerous for young people with a predisposition to psychosis to take psilocybin. When I ask Watts about this, she points me to a study from a mid 20th century where a participant had a problematic psychotic response to LSD. When it was further investigated, it was found that this person was a twin brother of someone with schizophrenia. And so now these types of first degree relatives are excluded to prevent this from reoccurring. Obviously, more research is needed moving forward. It's not conclusive, says Hendricks. I even think there could be a future in which we examine psilocybin as a treatment for schizophrenia, but it involves, obviously, affective disturbance and depression, and I think there might be a case for that. Okay, so I'm going to end there, and then the next video we'll move on to bipolar disorder, other mental health concerns, epilepsy, and history of seizures, possible drug interactions, antidepressants, Wellbutrin, mood stabilizers, benzos, cannabis, alcohol, MDMA, DMT, GHB and ketamine, hallucinogens. And then the last part is healthy frequency of use and how often is too often to trip. So I will break these down into smaller videos. All right. Bye, guys.